Hello, everyone. How you doing? Today is the beautiful Wednesday, February 19th. I was just going to say, if you hear me coughing, I got sick, and I don't know how I got sick, because I was like sick 3 weeks ago. I got sick again, and I think it's because my sister has twins that are 10 months, and I have noticed a pattern. Anytime I hang around them, I get sick. So I'm blaming the children. They're the only ones that can't argue back and not let me blame them. So I'm going to blame them because I'm like, I haven't been doing anything crazy. But anyways, welcome, everyone. You are joining us here at one of the IOCDF's live streams. If you are brand new to us, the International OCD Foundation is your largest and global supporter of OCD related conditions, as well as co-occurring conditions. And that's what we'll be talking about in a second. But please make sure at some point, preferably after the live, so you hang out with us, head over to IOCDF.org for all things OCD and related. There's so much good information. There's upcoming conferences. There is blog posts. There are special interest groups you can join. There's so much good stuff out there. So please hang out with us there. But if you're joining us, the IOCDF has live streams. It's an opportunity for you to have community, get education, hang out with other people with OCD. So as you may notice, whatever platform you're on, we are on Twitch, we are on LinkedIn, we are on YouTube, we're on Facebook and social media sites. There's a comments and chat. Make sure you let us know where you're joining us from, who you're here to support. You can tell us a little bit about your background. You can ask questions. You can engage with other people. So we really want this to be your stream, and you can engage in it however you'd like. As you can see, I'm not solo. So I'm going to introduce my guests in a second. I'm going to introduce myself and then have a little bit of housekeeping stuff. So my name's Chris Trondsen. I am a licensed therapist here in Orange County, California. I'm also a board member for the IOCDF, and I am somebody who has OCD and related conditions myself. So kind of went full circle, became a therapist, and I'm here to answer any OCD related questions, either for a personal or a clinical lens. Before I introduce my guest, just a couple little housekeeping things. Remember that this live stream is educational and it's not intended to replace therapy. So for treatment-related questions, please work with your provider or contact a local clinician. You can use the IOCDF's online resource directory at iocdf.org/find-help to locate a trained clinician near you. The International OCD Foundation is not a crisis hotline. So if you are in a crisis or you are ever feeling suicidal or unsafe, please call the 988 Suicide and Crisis Lifeline by dialing 988, or you can go to 988lifeline.org or go to your local emergency room or call 911. Finally, we want to create a safe space and be kind and respectful to everyone. At the end of the day, we're all here to support one another. A note that this is being broadcast on several social media platforms and is being recorded. So you could definitely go to youtube.com/IOCDF and go to live and watch this back, or send this to a friend for them to watch it. Or if you go to Facebook and go under videos, I believe, or live, you can see this as well. So thank you so much for joining us. But I am not here alone today. I'm going to introduce my guests, but before I introduce them, the reason that they're here, one of the things that we brought them on for is the IOCDF has special interest groups, or we call SIGs. And it's an opportunity. It can be a clinician, you could be a parent, you could be a person with OCD, but you may also have a co-occurring interest or disorder that you want to kind of join, get community, get information about. So we are going to meet two of the SIG leadership from the OCD and eating disorder special interest group. And this special interest group was created with the purpose of addressing the significant comorbidity between eating disorders and OCD, as well as the most up-to-date research in the field, clinical implications, education, training, and the possibility for mentorship relationships. This group is open to professionals as well as community members with a similar interest or experiencing this comorbidity of symptom presentations. And if you go to iocdf.org and you look up special interest groups, there is a place where you can absolutely click and inquire about joining. But let me introduce my guests. So first, what you'll see, and I hope everybody else sees it in the same order, but in the top left corner, we have Lisette Cortez, who is a licensed psychologist and a certified eating disorder specialist in Florida, and founder of Compassionate Healing Institute, specializing in the treatment of co-occurring OCD and eating disorders. Dr. Cortez is a cognitive behavioral therapist by training and specializes in exposure and response prevention, or ERP. Dr. Cortez is a healthy at every size, HAES is the acronym you may have seen, aligned clinician and practices from a size inclusive and diet rejecting perspective, incorporating intuitive eating principles. Dr. Cortez incorporates self-compassion practice into her work as well as ACT principles. She's on the board of IAEDP, South Florida chapter for eating disorders professionals, and is president of Florida Psychological Association Palm Beach chapter and co-chair for the Eating Disorders and OCD SIG. So welcome, Lisette. How are you doing today?
Thank you. Well, I'm sure that was a mouthful, so thanks for going over that. But yeah, very happy to be here. Thanks.
I know I could not find my Dayquil today, so it's at my office, and I was gonna go to my office, but I was like sneezing it up. So it's good stretching my neck. It's good. It's good. Well, welcome, Lisette.
Thanks.
My other guest is Katie Jeffrey, who is a registered dietitian nutritionist, which I think I told you last year, Katie. That's what my mom is. She's a registered dietitian nutritionist as well. Oh. So I was the kid that grew up and only got 5 pieces of candy. My mom always put like beans and brownies. We always had like lettuce wraps. So I think a registered dietitian is amazing unless you're a kid of one. I always joke, but I do tell her that's why I think I'm healthier than the most. So good job, Mom. A board certified specialist in sports nutrition and the co-leader of the IOCDF's Eating Disorders and OCD Special Interest Group. Katie promotes a weight-neutral, non-diet mindful, and intuitive eating and fueling philosophy. Katie is passionate about increasing mental health awareness to help others receive effective treatment in a timely manner. Katie's mission is to empower individuals to honor their inner wisdom, make peace with food, feel comfortable in their body, cultivate a nourishing self-care practice, and enjoy a lifetime of emotional resiliency by bringing greater awareness, curiosity, and compassion to their behaviors, thoughts, and feelings. Well, welcome, Katie.
Thank you so much. I'm so glad to be here.
Absolutely. Well, if you are just joining us, we are going to talk a lot about today the OCD Special Interest Groups, which is the Eating Disorders and OCD Special Interest Group. We're going to talk about the co-occurring of OCD and eating disorders. I specialize and treat body dysmorphic disorder as well. So I work a lot of times with specialists that work with co-occurring eating disorders. So I'm going to seek some of those in. If you're watching, you can ask questions for the guests. You can ask general OCD questions for myself as well. But just hang out with us and engage. But what I would like to start with is tell us a little bit about the special interest group. So if somebody's watching this and let's say they have OCD, but maybe their daughter also has an eating disorder, or somebody's watching for themselves, or a clinician's watching and is like, hey, I have a client that has co-occurring OCD and an eating disorder. What is the special interest group's kind of mission? What are you hoping to do if somebody were to join the special interest group?
I think what I would start with is like how the SIG was started to kind of explain a little bit more of its mission. So Katie and I actually met during one of these lives before and found that within like the eating disorder and the OCD community, there's certainly a bit of a split. Like people are very much specialized on one and the other, but what we know is that there's a huge comorbidity between the two. And so we wanted to create a space where clinicians who were interested in this comorbidity or started to work with this comorbidity and wanted more guidance or, have had more experience and want to pass it on, the space where everybody could come together, consult, share about cases, and really like grow in this field. So although it is geared to clinicians in the consultation aspect of things, we also do quarterly educational series. So we bring experts around specific topics like ARFID or neurodivergence and eating disorders and OCD, things like that, where the community could also join and also learn about these pieces. And like you mentioned, sometimes people have gone a long time without getting a proper diagnosis. And I think at the root, we want to help clinicians get better at assessment, diagnosis, treatment, so that people can get to the proper treatment that they need. And I think that, our mission is really to create like a stronger space in the treatment of the comorbidity of the two.
And Katie, when people are joining, whether they're community members or they're clinicians, what are some of the main questions? What are some of the main misconceptions that you really feel is important to get out there? Maybe not even through the SIG, but just to the community in general. What are some of those misconceptions that you hear a lot that you're hoping to correct or you're hoping to educate the larger public about?
I think a few are just that helping clinicians to understand that when someone has OCD and some either food fears or a potential eating disorder, that they often can overlap and intersect, and OCD can often kind of jump on to food and food fears, and helping the clinician and the individual to be able to tease apart what may be OCD related, what may be an eating disorder, or is it simply all OCD perhaps? All of those like food fears stemming from OCD, because we do know that what we want someone to help to determine is what their core fears are, to then help to determine the appropriate and most beneficial course of action to be taking for that individual. Otherwise, what we found is that we're simply playing whack-a-mole with the symptoms, as opposed to really determining what are those fears stemming from. So if clinicians don't quite understand OCD and they specialize in eating disorders, helping clinicians to understand a little bit more about what OCD is and how it can present, so they can ask the questions to uncover what is that core fear and help to untangle if OCD is involved.
I want to start there. So definitely. So the assessment. So what I see in clinical practice, and especially specializing in both OCD and body dysmorphic disorder, is I'll see some people come in with ARFID. I'll see some people come in with an eating disorder, and it's about restriction, it's about weight, it's about image. I see some people with body dysmorphic disorder where they feel like certain foods may help slim down their cheeks because they feel like their face is shaped wide. I'll see men and women with muscle dysmorphia, so they're fixated kind of on what people are calling orthorexia, where they're eating very specific foods because it reaches their goals. I see people with emetophobia who's like, I can't eat these foods because they might make me throw up. BDD, I have clients that won't eat certain foods because it might make them break out. And so it does kind of feel like, okay, all of these things is definitely having somebody have an impacted relationship with food. So tell me a little bit, like, if all those clients come in, like, what does an assessment look like? How do we know specifically what is causing any kind of difficulty around eating?
Mm-hmm. You want to start, Katie?
Go ahead, Lizette.
Okay, so I think Katie mentioned the idea of looking at the core fear, right? What's kind of driving the behaviors. And you make a really great point, Chris. Like, we can see restriction, and it could be restriction due to body weight and size. It could be restriction due to how a specific part of the body looks, restriction due to fears about contamination, restriction due to, fears because of emetophobia or texture and taste. Like, there's so many different things that can drive the same behavior that we might see. And so it's really important that we start with, like, what's at the root cause of it? Like, what is the reason people are engaging in this behavior, to better know how to treat it? Because, if we kind of miss that piece, then we might not be really treating like what's underneath. And I think it's similarly when we're working on a compulsion with OCD, and people could do the same compulsion for like so many different reasons, right? But if we don't know like what's behind it and what's the core fear at the root, then we're kind of missing like what we really should be treating.
Yeah, no, I'd love to hear your opinion on this, but I was working with a client who had gone to 3 different treatment centers for eating disorders, and finally the mom just stumbled upon OCD. But the client was eating certain foods because they had a really good day. It was like the first day they didn't have like bad things happen according to them. And so they ate the same diet every day because they felt like, if I eat the right diet, a good day will happen. It had nothing to do with appearance. So this person was like in different programs. So talk about sort of why it's important to start to marry like eating disorders community, OCD, BDD related disorders, all these different things. Why do you think that's going to help people suffering in general? Kind of like my client who finally got the help they needed versus, going to eating disorders. And they were just like, I just didn't relate to anybody in the programs.
Good point. And I think Katie and I see so many people that have had that same story, unfortunately, that they kind of don't fit here, but don't fit over there either. And it's like, where do we go? And, we can't provide treatment for someone in such a cookie cutter type of way of, okay, we're just going to do these meals and you have to eat these components and, follow the meal plan type of thing, without kind of exploring like, whoa, what's a safe food versus what's like an unsafe food, and how come, and what would happen if you didn't eat this kind of food. So we would miss so many of those components on the aspect of, this is more related to OCD. And I think on the flip side of that, when we're working with someone who is restricting due to OCD and they're not in a good nutritional space, they're not really like paying attention in session, or they're more irritable, or they're low energy, or they're very fatigued. If we're not treating the part of, stabilizing their nutritional well-being, then we're also not giving them the best chance at really being able to be successful in engaging in CBT and ERP. So it's so important to see both sides of it. And this is how come Katie and I do a lot of teamwork together, because there's a lot of clients that I'm not going to be doing much with them if they're not in a good nutritional space.
Yeah, I wanted to bring you in, Katie. I probably, because my mom's a registered dietitian nutritionist, I've always seen the power of having an RD be a part of a treatment space. So talk a little bit about, if anybody's watching, what are some reasons to bring in a registered dietitian nutritionist into the treatment? What are some times where it's like, hey, if somebody's watching or a clinician, this is really important to get someone involved?
Yeah, I think, not anytime, but many times when anyone is dealing with anxiety or depression or any type of, different moods, our appetite is greatly affected by our moods. And so understanding that component and how does different moods affect you as an individual. So for some people, they lean more towards the restriction. For other people, they lean towards more overeating or a combination of the two. And that can wreak havoc with someone's ability, like Lizette was saying, to be able to concentrate and have the energy and the nutrition that their bodies and brain need to be able to do the hard work of recovery. And so having a registered dietitian on the care team can be so helpful, because the dietitian is trained in looking at what someone is currently eating and seeing where they may be having, are they consuming enough for their energy needs? Two, do they have, are they consuming enough nutrients, or are there any particular nutrients or food groups that they're not consuming enough of to get in particular? So like iron, calcium, different nutrients. Are they deficient or insufficient in certain nutrients that would be helpful for their overall health and well-being, and particularly mood? Dietitians are also helpful in just looking at, is someone eating frequently enough? Are they just consuming enough, as opposed to having big, long periods of time when they're not consuming food, which greatly affects energy and mood. So really doing a complete assessment is really helpful for the individual. One, for their overall health, because we want to have someone be medically stable when they're starting to work or gradually moving towards medical stability. And then two, because they will feel better, both emotionally and physically, when they're consuming an adequate amount of nutrition and energy for their bodies.
Yeah. And I want to throw it to you, Lisa, and I have a couple more questions for you, Katie, on that very topic. But one of the things that I feel I didn't see in our field for all of us, right? I didn't see in our field maybe 10 years ago that I'm seeing much more now is like this idea, like we have to treat the whole client. They're not a set of OCD symptoms, right? And one of the things that I've started doing, in the last maybe 5-6 years of treating is checking in, like, what does sleep look like? Because if I have a client that's getting 4 hours of sleep from like 3 a.m. to 7 a.m., they're not going to be their sharpest in session. Are you misusing substances? Are you, what does diet look like? Are you restricting eating because you're depressed? And then, like you were saying, Lisette, you can't concentrate in session. For the clinicians watching or the people getting treatment and their loved ones watching, why is it important for clinicians to take into account some of these wellness factors? And why is that helpful in both OCD and co-occurring disorders treatment?
Yeah, I love the idea, like you said, treating the whole person, right? We can't treat, symptoms in a vacuum. There's so many pieces of what make a human being that, relate to their mental health and their stability that we need to take into account. I mean, I don't know about you all, but if I don't get good sleep, I am not functioning well the next day. I know that, right? Or I know that if it's my lunch got delayed, I'm definitely feeling a little more hangry. right? That's happening. So these different factors are affecting our stability. And if we're not looking at what's happening underneath, then we're missing so much valuable information. And across the board, even if a client's coming in for anything, really, I ask them from the start, what does a typical day of eating look like for you? From the moment you wake up to the moment you go to sleep, like walk me through it. Because if someone is having a really hard time at school, let's say, and then we're realizing they're not eating breakfast, they're skipping lunch at school too, how are they going to be able to have energies to function at school? And then, this might get misdiagnosed as ADHD or behavioral issues, or it's like, wait a second, like, are we looking at the foundation of where this person's at? And if the foundation is rocky, like, things are not going to look so well after that. So I think it's really looking at like the whole person means that we take all of those pieces into account and we don't just treat the symptoms just for themselves.
Yeah, absolutely. And it's so important. And I think that's some of the criticisms I'll hear sometimes from clients is like, they went to a residential and they're like, I got good on OCD, but some of my wellness factors weren't taken care of. And I don't know how you both feel, but I always had an advantage having a mom who was, registered dietitian, nutritionist, but we don't spend a lot of time in schools and like educating people. I mean, I think, I've had clients that are like, I don't even know how to read the back of a package to see ingredients and stuff. So I think it's important. Katie, what I wanted to bring you in for is one of the questions we get a lot on here about both kind of like the connection between the brain and the gut, the mind-gut connection, the serotonin in the gut. We also get questions like, is there a diet that seems to, or certain foods that either help or exacerbate OCD symptoms, depression symptoms, anxiety symptoms? So can you talk a little bit first about the brain-gut connection? And then second, like, is there foods or diets or things we should stay away from, sugars, caffeines, et cetera, if we have OCD, anxiety, and related disorders?
Sure. Yes, there's a huge gut-brain connection. So really important to have that piece. Huge portion of the serotonin is produced in our gut. And so that's important to know. There's no one-size-fits-all approach. It's really thinking about all foods can fit and all foods do fit for every individual. And it's having that awareness and compassion around food. And what I always like to encourage clients I'm working with to do is to be a scientist themselves and experiment. When you consume these certain types of foods and amounts of foods, the timing of your meals and snacks, how do you feel? Not how your mother feels, not how your significant other feels or your friend feels, but how do you feel when you consume these foods and these amounts of these particular foods? Because really, we want someone to increase their inner wisdom, is what I refer to it, their trust with their body and how their body responds to certain foods. Because if I have a food allergy, I might not be able to eat tree nuts. But Lizette might be fine eating nuts, and nuts are a great source of protein and heart-healthy fats. So we just want to think about overall that having a great variety of food will increase your gut microbiome, and that is so important for our mood and for overall well-being, to have this diverse gut microbiome. And so that's where variety is so helpful for people. Now, one person's variety may look very different from someone else if someone has RFID or food sensitivities. So we want to keep that also into perspective. We want to think about nutrition not as black and white, but as a very big gray area. And again, every body is going to respond differently to different foods and different types of foods and timing. So again, we really just want to think about variety, all foods can fit, and then experimenting to see what works best for you and your lifestyle, and what you value for you as health, because also what health means to everyone is different. And we also want to honor that and be just aware of that component too.
So just for clarification, so for instance, like sometimes people will say, hey, I've gone gluten-free. It really helps reduce my anxiety. But as of now, there isn't like a specific diet that, hey, if you eat this is like the OCD diet or the anxiety diet or depression diet. There's not something out there like that as of this time.
Exactly. Not that I'm aware of, that I've come across yet. There's not just like that magic diet or one kind of right way to eat that will, be best for everyone, because we are all so unique unique and have different genetic makeups. So we really just want to think about, again, what will work best for you, and finding, the different varieties and different foods that work best for your body is really important, because you brought up that great example. Some people will feel better going on a gluten-free diet because of, again, their genetic makeup and how they feel. Other people, though, will not feel better on that. So we just want to be really aware of those components and really keeping kind of that radar out for, is this a fad diet? Is this something that could be more harmful than actually helpful? Because when we start to take out food groups, we're also missing the nutrients that are contained in those food groups. So we just want to be very aware of, is this too good to be true? And if it kind of seems like that, kind of just think about, is that kind of a red flag? And is that maybe too extreme for me? Maybe I want to go a little bit more gentler when I'm thinking about foods and what I want to consume. And thinking about, we really want to come back to like, what foods are pleasurable for me? The enjoyment of food is really important for us to really be thinking about. Like, what foods bring me pleasure? What foods feel best in my body? What foods do I love to eat? And really have that as the foundation. And then we want to sprinkle in what we refer to as gentle nutrition information when we think about intuitive eating.
Yeah, it's so true, because everybody's different. I know for me, when I was at my worst, I could not have caffeine. It just made my anxiety, my panic attacks terrible. Now, if I don't get my green tea or matcha green tea, you don't want to know me, right? Like, I don't really get hangry. I get green, whatever, like a lack of green tea in your system is. But I know, like, I had a 3-week intensive where the client had emetophobia, and 19-year-old male, loved his fast food, right? And so that was the exposures to really go to different fast food places and eat. It brought him life. He was excited. He was happy. I ate with him, and I will say that was 3 weeks of really hard mental health for me personally. So, a set of foods made him happy, and he was winning treatment, and he was great. And for me, it was making me very sluggish. So I do think that, I think a lot of times people want a one size fits all. I want to get back to you, Lisette, but how about Katie with supplements? We get that a lot. I know for me, like, taking a probiotic usually makes my gut feel better. I take certain vitamins and stuff, but a lot of times we'll get that asked as well, is there certain either supplements that are good for OCD and related conditions, or in general, if somebody wants to incorporate any supplements, is there anything that can sometimes be helpful?
So I say really to start with is to talk with your primary care provider. I always encourage individuals first to get some blood work done to see, like, where you're at. Do you have any deficiencies? So vitamin D for many people tends to be lower based upon where you're living. And then we want to just think about food first and supplements second. So someone can get those nutrients through food. We really want to encourage that first. That's how nature intended us to be getting those different nutrients. But then if someone chooses, say, just as an example, if they're vegan, if they're more plant-based, they may not be able to get certain nutrients in through their diet. And then that's when we move into supplementation in a way that is supportive to them, and also not too much, because too much of anything is just too much for our bodies, and we can overdose on supplements. So we do want to, when we think about supplements, be working with a registered dietitian and a primary care doctor, getting some blood work done to make sure that you're not over supplementing, because that's really important. And so I always start there as the foundation, and then also looking at what they're currently eating. And again, if someone has, say, food allergies, we want to be just looking at that to see, is that maybe why they're not getting a certain nutrient. People can decide to take a multivitamin as kind of an insurance thing. However, you may not need one if you eat a variety of fruits and vegetables and grains, just different types of foods. Then you may not need a multivitamin too. And you want to be careful too with multivitamins, because of the fact that some have a lot higher than the RDA amount of each nutrient. So you could potentially be taking in too much. So again, you just want to be aware of that. The other thing with supplements is that they're not regulated by the FDA. And so if you do decide to take a supplement, again, always check with your primary care doctor. And also, I always encourage clients to find ones that are what's called third-party tested for quality, purity, and disintegration, to make sure that what's in the vitamin or supplement is actually in the supplement themselves. And that's just important for overall health.
Yeah. And I like your advice too about getting blood work. Like most people, I was very deficient in vitamin D. And I know, like, when I started getting more vitamin D in my diet, just felt a little bit of a boost. So I think it's important to find
Yeah.
what you're deficient in.
Yeah.
Lisette, I was thinking as I was reading both of your bios, and you're talking about healthy at every size. One thing I want to talk about is I used to run gyms before I became a therapist. I have BDD, I treat it. And one thing that I like about both of your bios is there's a lot of diet culture being shoved down people's throats. I think now with social media and online, like people are now having it shoved in their throats every day. I think of some of my older clients are like, hey, I would get a magazine or see it at the grocery store, but I was not having it shoved in my face 24/7. Now there's research that kids, as young as 8, girls are starting to mention that they want to go on a diet. So can we talk about how do you treat some specific eating disorders needs if somebody's really struggling with that? And how can they navigate? I just think that's a healthy balance. Like, how do you navigate all of that information that they're getting that's convincing them, like, it's great to lose 10 pounds. You're going to get compliments. Like, how do you touch that on their mental health to ensure that, they're getting the treatment they need and they have the tools to kind of deal with everything that's coming at them?
Absolutely. I think it's definitely ramped up in the last bit. For sure. And I think social media has just made it so much more in our face. It's kind of hard to escape. But I think to help someone be more of a avid consumer, let's say, I think it's important, especially with the little ones, right? And a lot of times when I start to do this work with my clients, we talk about not only like misconceptions, but like what were you taught? Like when did you first learn that maybe like something about your body was inadequate, right? Because we're not born with like, oh, I don't like my, this over here. At some point in our life, we might develop that in some sort of way. So I think tracing back those beliefs, where they came from, is a good place to start. And then also helping them understand that the diet industry, it's like a multi-million-dollar industry, right? It really makes money out of people disliking their bodies. So there's going to be a target for that, and understanding that this is really like a money-making scheme in many ways, and so to take it more in that perspective and understand that that's the goal helps us kind of take a little bit of a step back. A lot of these like wellness and things are diet culture like disguised also. I just want to put that out there. So we also want to be careful when people are intaking like information from like a wellness perspective, because a lot of times it does still have that underpinning message of change your body, follow this diet, this is the one that works for everybody, kind of like what Katie was saying. We can't take a one size fits all approach. So part of it is really being able to question what's being put out there and look at like, where is it coming from? Where are these messages coming from? And a lot of times there's businesses trying to make money above anything else, right? And if we begin to challenge that a little bit and come back to like, what do I need myself as a person versus like what I hear out there that should be good for me, then we can start to kind of tease apart some of those messages.
Yeah. Exactly. And I always tell people, like, a lot of that messaging is coming from out there, but when you really kind of ground yourselves and you look at your friends and your families, like, what are the things that they love about you, right? Like, your friends and your family aren't having the same messaging towards you as you're getting from some wellness blogger, right? And so a lot of times, I'll look, one of the things I do with clients, especially with body dysmorphic disorders, like, where are you getting your ideals from, right? And often it's like, my mom always talks about it, Katie, is like, everybody calls themselves a nutritionist because they don't have to have any education to do that. And they decide like one day they just want to start an Instagram and call themselves a nutritionist. And then they're giving maybe advice that worked for them, but may not be helpful for others, or they're making food advice that somebody who has certain restrictions or certain certain allergies may not do well with. So I think that's a big thing about it too, is a lot of times, younger people will see stuff on TikTok and I'm like, anybody can start a TikTok. It doesn't mean that it's science and medically based. So to be cautious, like, where you're getting that information from. Mm-hmm. There was a question, Katie, that I want to throw out for you from Michelle Swearin, Amanda, that's at 12:30. Where do you recommend somebody get their blood work? You talk about getting some blood work. Would you say like a PCP, a psychiatrist, a holistic provider? Who usually is best to get some blood work done to find out if there's any deficiencies or certain things that somebody should take into account?
Typically people start with their PCP. You could also though go through your psychiatrist, whoever maybe you're most closely working with, who really knows your history and what you're currently coping with, can be a great first starting point. But I would say one of those two would be helpful, whatever. And you may be, working with maybe a more holistic provider who could also be helpful in that regard. But someone who really knows your history and currently, again, where you're at currently can be very helpful, because then they'll be able to recommend, write a script for what's most important for you to have checked.
I want to throw another question out, and if we every second week we have a psychiatrist on. So if you feel like this is better for a psychiatrist, totally don't mind putting it on that list for the second Tuesday. But Terracotta asks at 12:29, what do you guys feel about taking folate for added benefit for mental health? My psychiatrist told me that there is a medical grade folate that helps with boosting antidepressants. Is that something you've heard, or does, you were talking about making sure it's type of supplement, making sure that, if it's medical grade or coming from a psychiatrist, is that usually the best source? I guess is my main question. Like if somebody's working with a psychiatrist and they're recommending something, is that usually like a trusted source that somebody should take into account?
I would say yes, working with your psychiatrist would be important. And then you can also, if you are currently working with a registered dietitian, also ask if those two providers can be speaking, or that you can relay the information to make sure to kind of just check in to say, like, how much folate might you be consuming, and are you taking other supplements with folate? Because folate is one where you can take too much of, like any supplement. So you just want to be aware of that, and really talk to your psychiatrist, like how much that individual is recommending for you, and does that exceed kind of the recommended amount, and what's the upper limit that's might be too much for you to be taking.
Yeah, I think one of the big things that you just touched on that's so important is I will hear some of my clients taking supplements, and I'm like, great. And did you ever run that by your psychiatrist or anything? And they're like, oh no, I didn't even think about that. So I always tell them, like, you could run it by your PCP or your psychiatrist. And that way that person has a very close understanding of your health and your records and things like that. So
Exactly. Yeah. And sometimes certain supplements are contraindicated for prescription medication. So we also want to be aware that there can be, like you might not want to take a higher dose of, even though, like, I don't know, let's say vitamin C, because you're taking someone else. I just pulled that one out. But again, you just want to be careful when you're kind of starting to dabble into more what we call therapeutic doses of vitamins and minerals, because of that effect. And sometimes too, like B vitamins, if you take a higher dose of one, you need to make sure you're taking a well range, because they can create deficiencies in other ones. So you just with the way that they're absorbed. So we just want to be very careful with different vitamins and minerals that you're taking supplementation forms of.
yeah. It's not really a question, but there's a comment at 12:27 from Isostasia. My OCD symptoms worsen whenever I don't eat enough. Definitely. Yeah. I mean, I've had clients where if they don't get sleep, their OCD is a beast the next day if they haven't eaten. I always talk about halts. Are you hungry? Are you angry? Are you lonely? Are you tired? Are you stressed? Right? Like, just do a quick check-in. If you're finding yourself just really worked up, yet there isn't really a trigger moment that just happened. And I'll have clients that are like, I used that the other day and I just realized I was hungry. I swung by, got some chicken, or whatever they ate. And they're like, I noticed that I calmed a little bit. I'm like, yeah. What I want to toss it to is, can you talk about the comorbidity between OCD and eating disorders? Is it high? Do we know why there might be that level of co-occurring disorders? Why is it that high? Things like that. So, maybe start there. Is there a high co-occurrence of the two?
So the short answer is yes. I think it's about 18% life prevalence of comorbidity. When someone has OCD, when someone has an eating disorder, that they'll also have OCD. And then again, I'm sure that these are probably pretty underreported numbers, I would say, especially in like what we see. And I think part of it is because so many symptoms do tend to overlap. Obsessions, compulsions, they just look a little bit different in an eating disorder presentation than they do in like OCD, but it still has a similar mechanism. And a lot of times, even when there is an eating disorder, there can be, a theme of OCD present that has nothing to do with food, right? And then we would kind of see the both. but on the flip side, there is the overlap of people might be restricting or eating, etc., due to a specific symptom of OCD. So behaviorally, I think there's more comorbidity than just like if there's a diagnosis and the other diagnoses, and we're saying like they overlap.
Yeah. Can we talk a little bit about the treatment? So maybe let's start with ARFID, because we've gotten some questions in the past about that. And then we could talk about other eating disorders, whether it's anorexia nervosa, whether it's, binge eating or binge eating with purging, and just kind of like the main ones that you see in your practice. What is the general therapy? I know you can't do a whole treatment plan in the time that we have, but what are some things that people should be looking for in treatment, and knowing that they're getting evidence-based proper treatment for the common eating disorders that we see?
So I would say number one, that this might be a little bit like up to the side, but I do think it's important to mention not working with someone who is weight loss focused, right? I think that's very important. Dietitian or a psychiatrist, or someone who understands that all foods fit is very important, who can even implement intuitive eating is very important. And when we're working with ARFID, although we do want to have a little more flexibility and be able to accommodate, maybe people have a little bit more of a limited variety of foods to start with, it's important to meet them where they're at. And what I always work towards is increasing volume at first. Even if it is your 3 or 4 preferred foods, okay, that's all right. Let's just get you eating well. Let's just get you enough nutrition in terms of volume before we start to maybe implement these feared foods, or see if these can be tolerated a little bit better, or under these kind of circumstances. I think it's a step-by-step approach based on also the type of ARFID that people have.
Yeah. And then how about other eating disorders? What are some of the common treatments for those? Like, what are the common eating disorders that you see, especially co-occurring with OCD? And what is the common treatments that people should be looking for when they're looking for a provider?
I think, I don't know if there's specifically, and correct me if I'm wrong, Katie, but I don't know if there's specifically like one, like anorexia, binge eating, bulimia, amongst those that typically shows up with OCD more. I don't know that haven't seen too much of a difference. Maybe a little bit more anorexia, I would say.
I think that's what I would say too. A little bit, based upon my clinical experience, a little bit more anorexia restriction.
Yeah. Right. And I think similarly, right, we would start with normalizing eating patterns and having people fuel throughout the day, not necessarily at one time of the day. And if it's too difficult to have a full meal, then starting them off with smaller pieces of a meal or snacks, to increase and kind of regulate a little bit. And starting to check in like hunger, fullness, throughout the day, energy levels, a lot of mindfulness work I think would be important too, just to pay attention to how you're feeling based on how you're eating, so you can start to help yourself make more supportive choices to carry yourself throughout the day. And essentially, Katie and I do meal support with our clients. We'll sit down and have breakfast together, or bring in like a feared food and eat it with them, and process how it feels like to eat something that maybe violates certain rules due to OCD, due to eating disorder, and kind of like explore like what would happen if you eat this kind of food. I think that would be kind of like the start, and of course collaborate with your dietitian, making sure that the person is working towards a more sound and medically stable nutritional state. I think this would be kind of like the first steps.
Yeah, I have a question that I want to ask you, Katie, but just for like some personal kind of transparency, like since I can remember, I've always struggled with binge eating, where I can eat 1,000 to 2,000 calories in like a sitting. And I found what you were saying, Lisette, what was really frustrating when I was seeking help was there was such a focus on weight, and it wasn't really about the weight gain for me that I was concerned about. It was just more this idea that I would kind of restrict through the day, and then at night would just gorge. And I also didn't like the feeling of loss of control. And that was more my concern. And it was sad that the kind of the help that I sought out was much more about weight focused. And to be fair, it was like a general doctor, right? And maybe that wasn't the best person to have gone to talk about my concerns, but I think that was what was really frustrating, because that wasn't really my concern. I mean, did I love the weight gain? No. I mean, there were certain things like going upstairs and things that were difficult with the weight gain, but I think for me, it was much more like I want somebody to help me kind of eat throughout the day evenly. I want to trust my body, like to eat when I'm hungry. I don't want to have this idea that if I restrict all day, I'm doing good. Like, it was more working on that. And so sadly, it was really, more so just like when I started working in the field and getting training, I had to use the tools I was learning to help clients on myself, and found, I'm not perfect with it. And there's some times that I struggle, but in general but what I love about the movement that I feel like this community is doing, and y'all are leading it with the IOCDF, is when we only focus on weight, first of all, half of the time, everybody's body's different. Everybody needs are different. And when we try to put everybody in this like fake little box, it doesn't help anybody. And so I think, anyone who's a clinician out there, there's a lot of really good stuff that people in the field are doing, and to really take account, because you can be hurtful, or you can kind of, really, really have somebody like myself feel defeated and not get the help that they need. So just glad what you're doing. Katie, I want to bring this in, and Lisette, you could totally jump in on this as well. Chronically Chris, because I like this question at 1224, says, some of us live in a vicious symptom cycle between physical illness and mental illness, and it's very difficult trying to break that cycle. Like when your physical health impairs your mental health, and your mental health impairs your physical health. I don't want to assume, but I'm guessing because of chronically in the title, they may be experiencing a chronic illness as well. You talked about a little bit earlier, Katie, about this idea between a treatment team. How does one, if they're going through some mental health and some physical health, and it seems like sometimes one's up, one's down, why is it important to have a team to maybe support someone going through this?
Yeah, it's such a great question. And I'm sorry to hear, chronically, Chris, of the cycle that you're in. It can be so difficult, because you're right. When we're kind of dealing with both of those, it can be hard to get maybe the most effective care for someone. So that's where having a very comprehensive treatment team can be so helpful. And the reason is that we're all trained in different modalities, and we're all coming from different perspectives. And we're also hopefully all looking at the whole person too. So bringing each of our, say, specialties and our training into that equation with the individual that we're working with and working to support, having it different perspectives can be so helpful, because I may see it from one lens. And then when I talk to, say, Dr. Cortez and see her perspective, together we might come up with something that no one else has saw, because we're both able to talk and to see it from different perspectives. So if I'm able to work with, say, the individual's therapist, psychiatrist, and doctor, and maybe someone else too, and we're each talking and seeing like how we're kind of seeing what the individual is going through, we can really hopefully help to give them the most comprehensive care and help them to kind of break some cycles or some patterns that have been going on for a while.
Yeah. There's a follow-up question by Chronically Chris, and I would be curious to get your perspectives. They said at 1220, how does this work for people in poverty who might not be able to afford a nutritious or specialized diet? I think one of the crimes, in this country, if I was running on a soapbox, is that healthy food is typically much more expensive than food that may not give somebody the nutrition value that they need or have the vitamins and stuff in the food. Is there any programs, or is there ways to get certain diets that you were talking about, balanced diets and all these different things? Is there a way that people can be creative or something if maybe they don't have the finances to get some of the nutrition value that they may need?
I think there is. I think being creative can be helpful. I know there are programs out there. There's food pantries in most places that I've been in that can be very helpful. I would maybe start with, I don't know, that you might be able to help with this too, but maybe just primary care provider and seeing what might be out there that might be available, in your particular area. There's also, just trying to think of just some different, like the WIC program, things like that. I mean, there's different programs out there. And there's also understanding too that frozen canned foods are just as nutritious as fresh fruits too. And I think sometimes we often think that they're not when they provide great nutrients, particularly frozen. And there can be some, so you don't always have to go fresh. So also maybe just kind of going to the grocery store and seeing like what might be available in different kind of, different areas of food can be very helpful as well. I don't know if that quite answered it.
Yeah, no, I actually saw like a special. They were just talking about it, but a lot of people don't go to food pantries who can, because there's this idea that you have to be a certain level of poverty to go, but they
Yeah.
actually welcome all people.
Yes.
I think also the more education we get, I mean, I've learned, for me, my focus on eating is never about weight or anything. For me, it's like I'm just trying to get all those different things, because when I get my blood test, there's certain things I'm deficient iron for a while, and I was wondering why my hands and my feet were always cold. So like now it's like if I get something, I'm like, oh, does it have some iron in it, right? So I think also just learning what creative ways you can get to do, but there's definitely some programs, so look for that. One thing that Isostasia says at 1219, they say my contamination theme impacts so much of like what I'm willing to buy and prepare for food. It made me think, like, I've had some clients also where their faith impacts what their OCD around their food. So, like Muslim clients aren't based on faith eating pork and alcohol, or some of my Jewish clients can have certain foods, or I'll have clients that are with celiacs and they'll go to eat, something that clearly doesn't have gluten in it, but they'll still read the packaging. So that's why if you all missed it, if you're joining us late, please, watch the playback and watch the beginning, because we really talked about that, why it's important for an assessment and to look at those core fears, because someone who's not eating certain foods because it's hard to buy and prepare because of OCD wouldn't benefit from an eating disorders program. They would benefit much more around OCD care. So that's super important. Lisette, what I wanted to ask you is, if somebody's watching this and they're experiencing both a eating disorder and OCD, do we feel like the field in general, there's a lot of people that treat both, or is that more on the rare side? And if it is, can people see two providers and have them talk to create kind of that treatment plan we talked about?
Yeah, I think that definitely collaboration is key. I think that there's still some room for us to grow as clinicians to really understand the best course of treatment for this overlap. But I think it's wonderful when an eating disorder provider and OCD provider can work together, work towards the same goals. We want to continue to support the field in being able to manage both well and, provide the best care for our clients. But collaboration can make a huge difference, definitely.
Yeah. I'm going to bring this question. I think we answered the first part, but we didn't talk about autism, but I think we could answer it again. A LinkedIn user asked at 1211, do we understand the mechanism that leads to increased co-occurrence of OCD and eating disorders? So that's the first part. And the second is, I see autistic teens, so I have them in mind mainly.
Yeah. Yeah, I think in autism, there's a lot of times a lot of sensory sensitivities, food selectivities. We've also seen kind of like this very specified, I learned this is the rule, so we follow this rule, that sometimes makes it difficult for people to have variety. And sometimes is working with clients, again, meeting them where they're at, coming from a very compassionate place around, can we have some flexibility around this? Can we try new things? And of course, understanding that some of these food sensitivities is not simply like we habituate and they just kind of, go away, but we help people navigate through those so that they can still get some proper nutrition, even if, like Katie was saying, we got to get a little creative.
Yeah, I know my nephew has autism, and man, I can tell you his order. He wants chicken fingers with ranch, with French fries, with lemonade, and a cookie. But because he's been working on exploring different foods to make sure he get different nutrients, he's found that he loves shrimp now and some other things. So we had to work on a lot of patience, but definitely that. I wanted to ask you, I was thinking about from that last question, one of the things that I heard, and I could have heard wrong, so you could correct me, this isn't Chris's belief, but I've heard sometimes from people that specialize in eating disorder treatment that they see that common occurrence of like sort of that like need for control that we have in OCD, like wanting things a certain way, wanting to be in charge of it. And they were saying like they see that a lot of eating disorders as well. Do you see kind of that co-occurring kind of like sense of control? I need to be in charge. I know my OCD is like that for sure. So just seeing, do you feel like that maybe might be a joint component?
Yeah, I think, go ahead, Kate.
No, go ahead, Lizette. I'll follow you.
Okay. I think coming from a place of uncertainty and tolerance, I think can fuel both eating disorders and OCD. And I think it's just related to different things sometimes, but there is definitely that idea that if I know specifics, or if I'm prepared enough, or if I did it right enough, right? If I am on top of making sure, then I can feel more secure and safer. And I think that can definitely overlap between eating disorders and OCD.
Mm-hmm. Yep, that's exactly what I was going to say too. That brings a sense of safety, right, when they have an intolerance to uncertainty.
Yeah. Sabir asked at 12:09. I'm Sabir from Pakistan. Welcome. I'm a software engineer. I'm suffering with OCD since childhood. I want to know that can OCD be treatable, or is it a long-lasting disorder? My symptoms include self-talking, self-smiling, etc. What I wanted to say, and the reason I wanted to bring this up, is because what I always want people to know is there's absolutely help. As you know, Liz McIngvale and myself, we hosted every first Wednesday now because she just had her twin, so I'll let her tell you all about it when she's on next. But myself, some of the other IOCDF advocates, there's an IOCDF advocate page. There are a lot of us that have gotten better. We have really good treatments. We know cognitive behavioral therapy with exposure response prevention, as well as other modalities that people are using, can absolutely help people get better. There's medications. We've been talking about lifestyle. We've been talking about co-occurring that may need to be treated, but there is definitely a lot of help. So Sabir, what I hope you can do is go to IOCDF.com. We have a find help section and really find a trained specialist. I always tell people, I have stuff with my kid. I get kidney stones, unfortunately. I don't go see a foot doctor. Like I never could say his technical term, but I just call it a kidney doctor, right? My point is, like, you just want to make sure that you find somebody that is specialized and people get better. It's a specialized treatment, and you want to make sure that you do that. There was definitely a comment earlier that someone said that having health, like actual health struggles, can make their OCD worse. And I think that that's what's difficult and tiring sometimes, is if you have other things, chronic illness, health stuff to take care of it. I did want to throw this question up, and I know we're about at time, so I'm going to give you all the last word. But Dis Better Than FIFA at 12:03 asks how to deal with what if OCD thoughts around health. What we talked about a lot today is actual health problems, but OCD can have OCD around health. And so just as we were talking about assessments, one thing that I do with all my clients that have health-related OCD is sometimes they do actually have health conditions. And it's important. We've been talking a lot about teamwork today. And so I'll work with their general doctor. What does this person have? What is the specific instructions for them? And then what I like to work on with a client is, what has Dr. OCD created? What things has Dr. OCD made up? Because Dr. OCD will make up a lot. I'll have a client that's like, oh, I get certain things on my skin. I'm supposed to put this cream for 3 days and I'm good, right? Yet they're using the cream for 6 months. They won't go out the house, etc. So I think, to answer your question, a big part is to work with your provider and see what specific health-related concerns are real and what is the instruction for it, and what is Dr. OCD creating, and really reducing and eliminating those things. What I want to do in our final 2 minutes is give both of you the floor. And what I'd love to hear is, how can people join the special interest group? What are kind of some things on the horizon? And what are you most excited about in the field that you can leave everybody with some hope and some excitement?
So if they would like more information and they would like to join, please visit at IOCDF.org, and within like I think it's like the pull down menu of like special interest groups, we have a what's it called, the Google sheet of interest. Basically, you will be signed up to our listserv, so you can get all of our emails, notifications around our meetings. so you can be in the loop. And also, our next meeting is in March. We just had our last meeting. It's the second Monday of every month from 12 to 1 Eastern Standard Time. And this will be our first educational series of the year, which is very exciting. And we have Jason Wood, who works for ANAD, and he has lived experience with OCD and eating disorders. He's going to talk about how advocacy has been such a huge part of his recovery, and just kind of share his story. And, we want to continue to bring people that can show us there's recovery is possible, number one, and people can live full lives even when, OCD and eating disorders have been present.
Well said. How for you, Katie? What are some final words?
First, thank you for having us on. Really appreciate the opportunity to just kind of spread the word that OCD and eating disorders do coexist, and working to find a treatment team that is comprehensive is really important, or can be very helpful for your recovery journey. And it's really about changing your relationship with food and perhaps your body as you navigate this. And so there is hope and there is treatment out there, and finding the clinicians that really know this space can be very helpful for people. And we work with many people who are back to living a vibrant life and getting to enjoy many different types of foods that they love.
Yes, absolutely. Everybody watching, if you have an interest in joining the special interest group, head over to IOCDF.org, find that special interest groups tab, email them and join, as well as we'd love to have you back. Obviously, this was great. There's a lot of comments of people thanking you for your advice. Make sure to head over to IOCDF.org for everything OCD related. And to take us out, I'm going to read this comment that always warms my heart. Someone said, I've suffered with OCD since I was 6, a very long journey, but now I'm in my 40s. I'm much better. I'm a confident person and I can handle OCD situations much better. And I'm actually living my life. Warms my heart. That's why we do this. And there's absolutely hope. Take care, everyone. We're here every Wednesday at 12 Eastern, as well as other live streams. So go to IOCDF.org/live streams, I believe it is. But we really appreciate you joining us. And thanks again, Lisette and Katie. Take care, everyone, and have a great rest of your day.
Thank
everyone.
You.